Hi, this is Dr. Nemechek, and this is my presentation I'll be giving at the 13th International Neuromodulation Congress in Edinburgh, Scotland on May 29th. This is concerning the reversal of Alzheimer's dementia utilizing transcutaneous vagus nerve stimulation in combination with an anti-neuroinflammatory regimen. Neuronal damage can occur through a variety of insults. There are physical traumas such as concussions, but we now are learning that intense emotional events can cause neuronal damage. Inflammatory insults can also do this, as well as toxic exposures. We now know that the traumatic brain injury increases the risk of Alzheimer's dementia fourfold, and that Alzheimer's involves a neurodegenerative process involving the excess production of pro-inflammatory cytokines, as well as primed M1 microglia. The graphic on the right shows the normal neuronal repair process. You have a damaged neuron that is detected by surveillance microglia. This will morph first into a M1 phenotype and followed by a predominant M2 phenotype. In conjunction with neurotropins and neuroprogenitor stem cells, the neuron then gets repaired. But this can be disrupted by excess pro-inflammatory cytokines coming from LPS bacterial translocation, excessive microglia, and dietary linoleic and palmitic acids. The prime microglia are being formed through a variety of stimuli, as we mentioned, bacterial translocation, repeated brain injuries such you might experience in professional football, an imbalance of omega-3 and 6 fatty acids, as well as exposure of diesel fumes that might be commonly experienced in cities such as Mexico City or Shanghai. And so you get the priming effect, forms an excess of microglia, which are now long-lived cells, are basically immortal and continually produce pro-inflammatory cytokines within the brain environment. This is added to by a variety of sources from the periphery, and namely we think the major one is bacterial translocation or leaky gut in the intestinal tract, and then excessive linoleic and palmitic acid. This has a combined effect of magnifying the damage with each subsequent injury, and through this negative effect on neurotropins and neuronal stem cells, an impairment of the recovery process leading to the familiar magnified damage, more damage and less recovery. And that's what we see here. This was first outlined by Cole Cunningham in his work with mice receiving vaccine stimulation injuries. And now if you have a normal inflammatory environment in the brain, you'll have damage but complete recovery, damage, complete recovery, and so forth and so on. But with this inflammatory problem we're now developing in the brain and understanding, you have a magnification of damage and incomplete recovery, leading to some residual damage. This then is accumulating injury after injury until you have a significant impairment of function. We now refer to this as cumulative brain injury. But cumulative brain injury can occur from, as I mentioned, from not just physical injuries, but also emotional traumas. And so we have concussions, emotional trauma from death of a loved one. A good example is broken heart syndrome leading to Takotsubo cardiomyopathy, surgeries or of long bones, of fractures, as well as vaccinations leading to the same cumulative brain injury phenomena. This often, though, is somewhat invisible in that people are not considering these as sources of added neuronal damage. We developed the Nemechek protocol to address these pro-inflammatory cytokines, as well as dysfunction and dysregulation of the microglia, stem cells, and neurotropins. Briefly, it's a course of rifaximin will limit further priming of microglia, as well as lessen the inflammatory cytokine production in the small intestine from bacterial overgrowth. We can utilize transcutaneous vagal nerve stimulation, DHA and curcumin, to shift M1 microglia into an M2 non-inflammatory phenotype. And then olive oil contains a high amount of oleic acid, which blocks the effects of the omega-6 linoleic acid and the saturated fatty acid palmitic acid. The combined effect is we now halt the magnification of damage and that the normal neuronal repair process is reactivated, leading to recovery of damage. In terms of Alzheimer's, our premise is that the excessive pro-inflammatory cytokines will normally inhibit neuronal repair mechanisms, and that suppression of these cytokines will reactivate normal repair processes and restore functioning of both autonomics as well as the patient's clinical status. We have two subjects. One is 62 and 67, both diagnosed by neurologists. One is a financial planner. He had growing difficulty with mathematical computations was his first sign. He couldn't pass his recertification test, and by the time he came to us, his forgetfulness had grown to such an extent he couldn't complete approximately 50% of all of his sentences, making it almost impossible for him to relate his medical history. Subject number 2 was a general contractor, and for the last 18 months he had progressively become unable to run his business that he had run for 30 years. At the time of enrollment, he was completely incapable of communicating any aspect of his medical history. The Nemechek Neurodegenerative Protocol involves transcutaneous vagal nerve stimulation for a 4 to 6 hours cumulative dose, patient administered via the tragus or the concha. And as I mentioned briefly before, we use a little bit of rifaximin, high dose DHA fatty acids, oleic acid, and extra virgin olive oil, and we use alpha-linoleic acid, curcumin, and resveratrol, and all the patients receive autonomic testing every few months. I should mention the olive oil we use comes from California, which is all tested at independent laboratories because of the high degree of fraudulent olive oil entering the United States. The NSAR autonomic testing is referred to as spectral analysis technique, which gives us both frequency and time domain data. The parasympathetic and sympathetic frequency analyses are normalized for the rate of breathing, which stabilizes, gives you a much cleaner result. And in 17 minutes, we can do a 5-minute seated test, 1-minute paced breathing, a Valsalva challenge, and a 5-minute orthostatic challenge, and does not require any specialized technicians. And we end up with this nice little report here that we can go over with the patients. And after each visit, or with each visit, we are retesting this, and we can see the patients progressively improve. It helps their motivation a great deal. Subject 1 had dramatic recovery of cognitive function and independence within 10 months of treatment. Over the course of 10 months, his mini-mental exam went from 24 up to 28. He now does not lose track of a single sentence during his last 60-minute medical encounter. Just a reminder, he couldn't complete 50% of these sentences on his initial evaluation. His speech is noticeably clearer, more fluid. His sleep and anxiety have improved. Balance is still off a bit, but improving. And he has occasional lightheadedness, for instance, getting out of his car. He's now able to travel alone by plane for his medical visits, whereas he previously had to be escorted here by family members. You can see we're starting to see some recovery of his autonomic function. You can see he had this very low parasympathetic resting state, which now is slowly improving here, but still steadily and quite significant for this condition. Subject 2 obtained clinical remission of his Alzheimer's within 7 months of therapy, utilizing the transcutaneous vagus nerve stimulator. Over 7 months, he now has marked improvement of cognition. He is able to fully relate the events of his life. He has returned to work as a managing contractor on one of his major operations. He can drive himself safely to work and his office visits, and his sleep, energy, and headaches are greatly improved. On his test, you can see again we have this low parasympathetic function. This is actually a reflection of intracranial inflammatory state, and we're seeing now after 7 months we're slowly getting this to recover. Conclusion, the vagus nerve stimulation and the Nemechek protocol have been able to restore cognitive function in both of these subjects with moderately advanced Alzheimer's dementia. Without vagal stimulation, the same regimen was incapable of reversing dementia in 3 prior patients. Here's a look at our device. It is able to, we think it helps dementia through suppression of inflammation, alteration of the microglia phenotype from the M1 to the anti-inflammatory reparative M2 phenotype, and through its induction of neuroplasticity, which occurs predominantly within the hippocampus, which is a major area of damage in Alzheimer's. We theorized that the longer continuous vagal nerve stimulation settings we use may be more effective than at induction of neuroplasticity than cyclical stimulation. By the year 2030, there's going to be approximately 76 million people globally that are affected by Alzheimer's. The simplicity and low cost of this treatment makes it very attractive in that it could have enormous global impact if it's been shown to be effective in larger clinical trials. Smaller vagal stimulators can be comfortably worn by individuals even in the earliest stages of disease and preventing things from progressing. Thank you, and copies of this poster and presentation are available upon request.